So, first time in Rwanda. How's it? First time visiting a PIH site. How's it been for you?
Yeah, it's been extraordinary. It's been incredible. I think not only have we been welcomed by the broader community, by the PIH family that's doing the extraordinary work here, but as we're touring the different sites, and as you know, we've been touring this beautiful campus at the University of Global Health Equity, we've seen the impact of our work. We've seen the impact that we have as PIH Canada, and we've seen the impact that our donors are making directly to making sure that these sorts of programs are happening and that they're sustainable.
Absolutely. I mean, even just at UGHE, we were told that, the first class at 30 medical students, which is a huge class already, but within 4 years, we might have 100 students. And these people go everywhere across the country, across the continent, to really serve communities in the greatest need. And it's all philanthropy funded. So it's really making a huge, huge impact.
And even, we're seeing the hospital. I'm not sure if we can see that in the video, but the hospital back there, we were told that not only has this work that we're doing impacted, doctors and PIH community, but we're impacting the entire region, right? Like we heard yesterday that the pay gap between men and women was closed in this region, that the economic development activity has led to increased infrastructure for the region. So not only is PIH doing good work in healing people and training doctors, providing important medical services, but we're also impacting the broader region to help develop a local economy that creates a better standard of living for everyone. I thought that was so incredible to hear.
Yeah, I mean, those are amazing statistics. They were saying that the average wage in the region increased 3x over the times the hospital has been open, which is an astounding amount of economic development. And we know that from a social medicine perspective, we need to ensure that people's economic needs and social needs are being met in addition to their healthcare needs. Another thing that really surprised us, yes, this hospital across the way is an oncology center of excellence. We don't sometimes think of, cancer treatment as something that the Global South really needs, but it is increasingly a problem. And, when this all started, we were told that maybe there was one oncologist for a country of 14 million people, which is completely astounding. But since it opened up, they've introduced so many training programs, so many trainees, and there's dozens of oncologists providing care all over the country. And so that really speaks to PIH's ability not only to affect care and change locally, but to partner with the Ministry of Health and other organizations to really scale that change across the country to make meaningful population level impact.
I just want to say a few more things about this because I think it's really important and really meaningful when you see the work, and not all of our donors get to see the work that's happening in these places. But as we were walking through the oncology unit, people were happy, smiling, waving. One of the patients said, "God bless you" to all of us.
Yes.
So we know that this work is changing lives. When we were visiting the maternal ward and the work that the doctors are doing to protect mothers and babies, you saw how important the facilities, the machinery, the specialists were to keeping babies alive, right? And just how powerful that is that we're making such a concrete difference in the lives of these families, of these communities, and these babies, which was so incredible to see.
One of the coolest parts about the trip was the chance to do a home visit. Valentina, Antoine, and their 2 twin daughters. One of their kids grew up with a developmental disability, and that really meant that the parents had to spend a lot of time in the hospital. They had to spend a lot of the resources, their savings actually, just financing that. And I should say that even addressing the developmental disability was something that PIH was able to do through their Pediatric Development Center. Because of that, they began to run low in finances, and so PIH did something really amazing.
Yeah, so when we went to this home visit, it was extraordinary to see just how supportive the PIH staff were for this family, bringing them supplies, bringing them food that they could use to make sure that it was one less thing to worry about, right? In the conversation, Valentina had talked about how she had to sell that sewing machine, which was her really her tool to bring in money and support for the family. And already, right, the local PIH folks were talking about how they'd be able to support that and help bring that economic vehicle back into that household and change their lives, knowing that they already have it so hard, or there's so many challenges dealing with one of their children who has that disability. There's a lot of stigma there. If they can have a tool to bring some cash into the household, just that would be one more burden and one more family who's able to provide for themselves.
Yeah, really, they treat patients here as people and consider the entirety of the person, right? Whether it's the food that's brought or the sewing machine that really allows for empowerment, not to say sort of all the medical support that's been provided. And so certainly that was one of the most memorable things. And you really can see the impact of donor and philanthropic dollars directly impacting the lives of the people that we got to meet, chat with, and befriend. It was amazing.